Alrighty, so yeah, you can probably hold that up. I think we are live. Let me, maybe I'll flip it around so it's better. Yeah. Hey, Dr. Schramm here. We're going to be doing an impression of the eye. Giving time to people to sign on. Diana, you are my timer. And then we start by lining him up. We got the pillow here. Got an X over here. And we're going to be doing the right eye today, right? The right eye. Point to the right eye. And I'm going to just check to see. You can come in a little bit closer. What I do is and actually come a little bit this way so that you're still looking toward the X. Just open up the eyes to make sure that it's pretty well centered. And then I do want to move him a little bit this way. Yeah, so that looks like it's, and I'm going to need to move it down, the X down a little bit more. And then let's go like Alec. Or, actually, we probably could just raise the chair. All right. Yeah, so we have equal conj exposed for upper and bottom, and nasal temporal. Cool. So we set the timer for a minute. We already signed the consent, sort of. We signed it for the other eye yesterday. Did you want to re-sign it for today?
Sure.
Okay. And we promise not to burn your eyes, but we can't guarantee it.
I'll take my chances.
I explained to you how the polyvinyl siloxane is FDA cleared for use on the eye, and
Yes.
there's a small chance of irritation, redness, blurred vision, chemical burn, but because we have the right timing, and I've been doing this for like 9 years of this particular procedure, I'm pretty good at it. So if you want to sign down here. In the meantime, I'm removing the pink. Do you have the, did you print out his name? There you go. Thank you.
Oh, yeah.
Thank you. You're the witness today. All right, it's all good. So for those of you just joining us, this is Dr. Schramm here. We're doing an impression, EyePrintPro, the eye. And I like to make sure that the lower lid gets out of the way, because that's one of the things that can be problematic when we're doing the impression. So I just have some tape here. CVS special. And look up, and then we put it at the lower eyelashes, just below the eyelashes. And then you can look back at the X. That's not irritating your eyes, right?
Just a little bit, but that's fine.
Yeah, I see it is. Well, you won't even feel it in a second once that gel is there. But yeah, this will allow me to pull down the lower lid easily, and it doesn't get stuck in the mold, in the impression. All right. And then we also we do a printout. We're not going to show the patient's name, but we do a printout. It would usually have the patient's name on there with the number, OD1. All right. And lastly, we grab a miniature martini glass. So have the timer set for a minute. I'm going to come over here, and then you're going to be over here, because once we put this into his eye, we don't want to get in his line of sight, because in the whole time he'll be allowed to blink while he's looking at the X. Fortunately, I'm ambidextrous. And then your also assignment is to remember to put the black marking on here when it's time to take the lens out, take the impression out. And so we're going to start now. And then I always try to aim more of it for the 6 o'clock, the 12 o'clock position. Take that. Because we want a little bit more goo on the superior edge, because a lot of the goo is going to come out the bottom. And we don't even need to numb the eye to do this. How much time do I have left? Because at the 40-second mark.
5 seconds to.
So we got 3 seconds. Okay. 2, 1, look down. And then look straight ahead. And he's going to be looking at the X the whole time. It's okay to blink if you need to. And reset the timer. Reset the timer for a minute or 2 minutes. It usually takes about 1:30 for this to firm up. You'll feel that it's a little wet right now. And as it gets firmer, it's no longer wet. Because I have a tissue, vascular tissue below his eye line. You feeling okay?
Yeah, it just was first a little bit cooling feeling, and then now it's just slowly goes away. And first when you put it in, it's just a little bit uncomfortable, but then it's not as bad.
It's still a little bit sticky, so it's not quite there yet, but we're getting close. How much time do we have there?
1 minute.
Okay. Probably another 30 seconds and we'll be ready. Anyone commenting?
No, just watching.
So we mark it at 12 o'clock, so we know exactly where it was on time. And then your job will be to draw the marking all the way up to the mold. Get that feels nice and firm. And take it out. Good job. You made a good first impression. Can we grab him a tissue? I don't know if it... And then,
Usually when you watch it, it seems like that it's probably painful, but it's not that bad at all.
right, yeah, and your eyes get real watery just because of the material, but it's not watery because of discomfort. And then the last thing we do is we're going to draw the line all the way up to the edge, even to the mold in case it were to pop out. And then we trim off the edges and pop it in here with the patient's name on there. All right. That's a wrap. That's how we do impressions.